Welcome back, everybody, to Midday. A stroke can happen to a person in an instant, but people with atrial fibrillation are 5 times more likely to experience a stroke. This week on Midday, we're partnering with the American Stroke Association and University of Utah Health to see the many faces of stroke. Joining me now is Sarah Dahoney. She's a neurology clinic pharmacist for University of Utah Health. Thank you for joining us on the show today. What role do you play as a pharmacist in care for people with strokes?
I have many different roles, but basically I'm talking to patients about new medications, making sure they understand them, making sure they can afford them, because price can be a big issue. We actually have a pharmacy tech that helps us determine if a patient can afford a medication before they even leave the office. And then looking for drug interactions, organ function, all kinds of things.
So are we talking stroke prevention medications or post-stroke?
Often the patients I'm seeing are post-stroke. That's how they land in our clinic. And so we're trying to prevent the second stroke, either by controlling their heart rhythm and or putting them on a blood thinner.
Can we talk about tips or observations that you've made and share with our viewers about the importance of adhering to your medicine schedule once it is prescribed to a patient?
Absolutely. So the medications don't work unless you're taking them. And we need to make sure that we as a team work with the patient to make sure we see all the barriers. Are you having side effects? Can you afford your medications? Do you need help remembering them? We need to hear from the patients if you're having issues so that we can strategize and figure out how to make it easier.
Is that something you should talk to your pharmacist about, or your doctor, or both?
Both, absolutely. Anybody in the healthcare system. We have amazing nurses at our stroke center as well. We all work together seamlessly, and so we can answer any of that.
Do you find that often patients just think this isn't working and stop taking it rather than communicate?
Absolutely. We can't fix something unless we know about it, and sometimes patients can't afford it. They'll just stop it. And please call us so that we can strategize.
How important, I guess, is the role of medication in a post-stroke patient?
That is the biggest way to prevent another stroke. It's essentially vital to help prevent another stroke that could be worse.
And is there a medication everybody takes, or are we talking about a lot of different things out there?
We have a few different classes. If you have AFib, we may try to slow down the heart or control the rhythm. And then most patients with a stroke are going to be on a blood thinner. And there are older ones like warfarin where you need blood monitoring, new ones that don't need blood monitoring. So it's 2 general classes.
The bottom line is it's so important to work with your pharmacist and your doctor and share information as much as possible.
Absolutely.
If you need more information, everybody, that website is right on your screen. It is strokeassociation.org. We can link you from our website, abc4.com/midday. Thank you so much for being here.
Thank you.
Brian and Em, over to you.